morning everyone. This is Dr. Fatima. I am working as consultant biochemist at KLE Centenary Charitable Hospital. Today I will be sharing with you some important facts on diabetes mellitus. Diabetes mellitus, as you know, diabetes is a very common disease. The exact prevalence of this disease is not known, but currently there are about 250 million people suffering from diabetes, and next year, that is in 2025, it is predicted that almost 280 million people will be diabetic. Especially in Asia, the prevalence of diabetes has been rising rapidly, and diabetes is one of the fourth most important cause of death worldwide. So because of all this disturbing statistics, diabetes has been described as one of the major health issue of human health in the 21st century. Now, to diagnose diabetes mellitus, to know whether you are diabetic or no, your doctor will advise you a series of tests. They will ask you to get the fasting blood sugar levels done. They will ask you to have your meal, and after 2 hours of your meal, they will ask you to get a blood sugar level done. But there is one such test which is known as HbA1c. HbA1c, which stands for glycated hemoglobin. This particular test can be done any time of the day, whether you are fasting or when you had your last meal, doesn't matter. Any time of the day you can get this blood test done. The name of this blood test is HbA1c. Some of the important facts about HbA1c or glycated hemoglobin that I want to highlight are: this test has been used for diagnosing diabetes mellitus. By looking at the levels of HbA1c in your blood, your doctor will decide whether you are diabetic or non-diabetic. They can also decide if you can develop diabetes in near future. This particular test has been recommended by American Diabetic Association as well as World Health Organization for diagnosing diabetes mellitus. The very important thing about HbA1c is that it helps in determining the blood glucose levels from past 6 to 12 weeks. It helps in retrospective assessment of your blood glucose levels in the past 6 to 12 weeks. So it is a very good marker. So you will come to know what have been your blood glucose levels in the past 2 to 3 months. So that is why this test is very useful. And some patients who are already diabetic, in such patients it is mandatory to get your HbA1c level checked, because depending on your HbA1c levels, doctor will decide whether your glycemic control has been good or poor. The higher your HbA1c levels means that your diabetic control has not been good. The lower level of HbA1c level would mean that your diabetes control has been good. So you can get this HbA1c level done at KLE Centenary Charitable Hospital Central Lab, which is located in the first floor. So you can visit us anytime. We are open 24/7. Thank you so much.